Assalamu alaikum. This is The Talk. I'm Robbie Hamza. Thank you for joining us. We've got a beautiful brother Omair, who's come from a faraway land to be here today.
Other side of the world, yeah.
Welcome, brother. Assalamu alaikum.
Walaikum salam.
So, brother, you've come from Canada.
Mm-hmm.
Your brother Zohair's, looking at him sitting on the couch. Dear friend of ours. We'll get him up here for a session at another time, inshallah. Right. How long have you been in Australia, and where'd you come from?
So I'm from Toronto. We grew up, born and raised in Toronto, and he moved out here in 2016, and we're just kind of biding our time for when's the right time and get a pocket of time to come in, and I needed at least 2 weeks. So I'm here for 2 weeks. I've been here for one already, so.
How you going with the weather?
Love it.
Yeah.
We escaped a 25 centimeter snowstorm in Toronto right before we left. And just this past weekend, they had another 15 to 20 centimeters. So I'm very content with the sun and everything else.
See, I'd love to swap places with you for a little while. I love the snow. I miss it. I grew up in North America, spent 10 years over there. And I don't miss like shoveling out the cars and all that sort of stuff. But just watching the snowfall is a pretty magical sort of experience.
It's definitely majestic. But it's the day-to-day grind of, the shoveling and the traffic. And
sliding all over the road.
Sliding and getting stuck. Yeah, that's
SubhanAllah. So bro, you work in the ICU. What's your role? What do you do exactly?
So I'm an intensivist. I've been sort of in independent practice for almost 2 years now.
Mm-hmm.
I work in sort of the Greater Toronto area in multiple different ICUs. So alhamdulillah, I get to see a lot of high acuity, very sick people, and unfortunately, many of them are as a consequence of substance use disorder. So we do end up seeing quite a bit of patients that you try to get them out of their acute illness, whether it be toxicity, withdrawal, whether it be sort of just as a consequence of being, like an IV drug user or, having alcohol use disorder, and then get them stabilized enough to sort of go to that next phase where if they're aiming for sobriety, then sort of allowing them and facilitating those resources. So I get to see people sort of in sort of really the thick of it.
In their worst moments.
Yeah.
I've heard it's pretty hectic in Canada. I've seen some documentaries and stuff to say drug use over there is wild.
Yeah, no, for sure. So we have in sort of the inner cities and in sort of the bigger cities, Toronto, London, Ontario, places like that, Hamilton, which is kind of the area in which we're situated. We do see a lot, unfortunately, IV drug use. We do have, our indigenous population who's obviously had a rough go with everything else that's gone on. And it's a huge endemic problem over there as well.
Is there like a particular drug of choice? Is there something that's really causing you more problems than anything else at the moment? Or?
So probably similar to America, like United States and here, you see probably alcohol being kind of the biggest culprit, but then opioids, fentanyl and heroin and all of those.
Yeah, that fentanyl's getting bad, isn't it?
Yeah. So
that's really knocking some people around.
Yeah. No, you're seeing, obviously opioid toxicity. You're seeing cognitive changes, and these are sort of almost to a point where they're irreversible, right? You have people whose decision making is altered when they're intoxicated, and then, you're getting multiple hits to the brain. So then over, years, decades. These are people who at a young age have impaired decision making, have impaired memory, and sort of all of those problems that come with fentanyl use and opioid use in general.
What's methamphetamine use like over there? Like we got a big problem with that here.
In methamphetamines, So massive. I mean, it's there, but I think the opioid crisis is probably the biggest in Canada, and alcohol as well.
See, I've been dealing with people here for the last decade, and then in my old life, in a different capacity,
right.
On different drugs and things. And the opioid stuff, I don't know, sort of, it's a little bit more hidden here. It's definitely still going on, but I don't know, the amphetamines just seem to be taking over.
Right.
It's just in recent times when I've had a sort of bit of a crash course in working with people, with opioid dependency, and it's a very different beast, eh? Yeah. Just seeing that physical dependency, watching them going into, rapid withdrawal and all that sort of thing. People don't realize it's not just a case of, we'll stop. You can't, it's not just, okay, well, I'll wake up today and not use again. Yeah. You can die from doing that, right?
Yeah. So the DSM-5, if you've heard of that, it's a diagnostic statistical manual, which is what we use to diagnose mental illness and psychiatric illness. So they have a diagnostic criteria for substance use disorder. It's about 11 criteria, and they're kind of divided into 4 categories. So there's obviously the physical dependence, which is a combination of both tolerance and dependence. So tolerance meaning, if somebody was to take, opioids for the first time, it may take sort of, one injection to get them high. But, the 10th and the 50th time, it'll take you more. So you become tolerant to that small dose. And now you're requiring, to get that high, you're requiring higher and higher doses. And as you do that, you're getting into these toxic amounts that are going into the brain that are causing, basically problems that you would get when you age, like constipation, cognitive impairment, balance issues. And then on top of that, when you get to these higher and higher doses, and you're getting other physiologic problems like respiratory depression, level of consciousness drops, right? So normal person breathes 12 to 20 times in a minute. You overdose on fentanyl or on heroin, you're breathing maybe 3-4 times a minute.
Wow.
Yeah. So, you're rushed to the emergency department, you're intubated, you're put on life support for airway protection until you wake up, essentially, right? And then you imagine that if nobody catches you in time, it may be too late.
I imagine it'd be frustrating. I mean, because you're not dealing with people who are checking themselves in because they're saying, I've had enough of this, I want to change. You're just dealing with people who've overdosed. It's their body is just breaking down and nearly expiring from their level of addiction and drug use. So you've got to sort of treat these people and bring them back to life, knowing that they're going to walk straight out of the door and go and use again, right?
Yeah. So that's challenging, both as a clinician and as a Muslim, to sort of see the low that you can get to, and sort of that loss of, self-respect, that loss of dignity by, you've just taken, you're a human being, you have, a sacred life, you've taken so much drug that you've almost died or you've, come very close, whether it's, alcohol intoxication, whether it's fentanyl overdose or whatever it may be, whether it's a heart attack from, excessive cocaine use, which I've also seen as well, like bad heart attacks in people in their 20s. And you're as a clinician, you kind of have to just put that hat on and say, I need to get this person stabilized, I need to get them better, I need to get them off life support, and get them sort of back to their functional baseline. So when you as a healthcare team are doing that, you're sort of, you want to work in conjunction with your addictologists, your psychiatrists, to sort of get these people into an emotionally and mentally better state where, maybe they don't repeat these vicious cycles. Sometimes it takes one of these events to wake people up, unfortunately, but a lot of the times it's too late.
Yeah.
Sometimes it's too late, right? I've seen a patient die from a cocaine-induced myocardial infarction or a heart attack, right? Because cocaine can affect your blood vessels and cause sort of increased contractility. So if your coronary arteries, which supply blood to your heart, shut down and just become, like have a spasm, and you're not getting blood to your heart heart muscle dies off, and then that kills you right away. Right?
See, people don't, I think a lot of people that are using coke don't see it as being something that's necessarily that dangerous. I know it's something that's on the rise within our community here in Australia, and I just think people have these stories in them, whatever we tell ourselves to justify different things. Someone who's using coke may look down on someone who's using methamphetamine or heroin, and they see it as something that's a little bit more, there's a bit of glitz and glamour attached to it. It's something that's more social, and as I say, it's definitely on the rise within our community. It's good. It's not good news, but it's good to hear these kinds of things and to educate ourselves about how dangerous it can be.
It's important to know, because it's not only the cocaine has that vasoactive property, but you're getting these drugs from not the most trustworthy people in the world, right? So they're cutting cocaine with, in North America, we have, I don't know if you have it here, levamisole, which is an like for tapeworms and sort of parasitic infections. So they're cutting cocaine with these levamisole because it looks like cocaine. So, if you want to sell 1 kilo, but you only have, a smaller amount, you add this as an additive. And people are taking high doses of this, and they're getting what's called cocaine-induced skin necrosis, which you sort of get like, big patches of skin that just dies off, and you get bad ulcers.
Ugh.
Those can get infected, and then you're running into, again, just consequences that, when seeking drugs, you don't anticipate. You anticipate, getting high or getting, whatever it is, whatever you're chasing, but then you get all of these unanticipated consequences, which accelerates, aging, which accelerates all of these things.
Yeah, the consequential thinking, it just goes, it's not there, right? When you're high, when you're chasing that high, it's not, all you're worried about is today, this moment, tonight, what tonight's going to look like. Tomorrow is just, you'll deal with that tomorrow, but it's all about today, right?
Yeah, and that's unfortunately, that's what I see. I see the people that are living in the moment and seeing that. And then obviously with the work that you do, you sort of try to once they're out of that, and then like you have to sort of obviously bring them towards some level of improvement and get them out of that situation that they're in, and seeing things sort of, lot more long term, which I don't get to see as much, although you do see some success stories, which is always great as well.
Talking about our community, the Muslims, like. Do you see a lot of Muslims coming through that are dealing with this sort of that you're treating with this issue?
You see them. I don't see them in sort of droves, for sure. But you see the occasional one, which obviously is very sad.
But what percentage of the population do we make up over there?
In Canada?
Yeah.
Like 3% maybe.
So similar to here.
Yeah.
We're about 2% here, right? Something like that.
Yeah. Like that, yeah.
So not heaps. One problem we've got here, and it's a big problem when it comes to this subject, is we've got no Islamic rehabilitational centres. Right. We've got no inpatient facilities in the country. There's not one that's culturally appropriate for us that incorporates deen as well as evidence-based therapies and things like that. We've been talking about it for a long time. I've been talking about it for a long time. We've had sheikhs and scholars come from overseas in South Africa where they do have places. Right. But it seems that globally we're really behind the eight ball when it comes to this subject. I had a famous scholar from the UK sitting where you're sitting here not that long ago. And I said, what do you guys do over there for brothers and sisters who are dealing with this? Because I presumed, wrongly, that because we make up such a large percentage of the population over there, there would be some facilities and stuff. And he said, to the best of his knowledge, there wasn't one there either. Yeah. So, what are we meant to do? We're sending people off to rehabs that, Christian faith-based organizations where part of their therapy means they have to go to church and read the Bible and stuff. And it's just, it's not culturally appropriate for us. Or places, with no particular faith attached to it, which is better for us. But again, it's not, we know as Muslims, it's not the answer for us. We know that the deen is part of not just getting better, but staying well and doing things differently in the future, right? Yeah. So do they have anything that's for us, by us in Canada?
Unfortunately, no. Not in at least the area that in Toronto area. We don't have anything that's Muslim-centric that sort of been proven to work in that respect. We have a lot of sort of da'wah in the correctional facilities and all of that, but as far as I know, we don't have, a place to connect Muslims that want to get better, that want to get sober, that want to get, out of the...
this just doesn't...
You've identified a huge and important void. Obviously, you need, capital, you need expertise, you need clinicians, counselors, nurses, psychiatrists, you need a full team. And if you can mobilize that with the funding, that's, that would be very, very important. And I think if you've identified a big enough need, especially in your community, I think it's something important to pursue. Our communities, alhamdulillah, have made great strides in a lot of things, but we're also very behind in a lot of things too. And I think that Toronto and here is similar in that respect. We have our challenges that we're going with, and I think this is definitely one of them.
Yeah, it's a massive problem. We just, someone comes to us, says, I want to get better. What should I do? Oh, okay, So
it is a tried and trusted fact that a support system will be of benefit, right? That will save lives. Yeah. That will, make people better. Without a support system, it becomes extremely challenging to come out of addiction, right? Because if you look at the DSM-5, I mentioned earlier, we talked about dependence and tolerance. But if you actually look at the other 9 diagnostic criteria, they're all around social problems, a lack of control, impulse control, and risky use, right? So things like, needing to take larger amounts, or wanting to cut down but not being able to cut down. The amount of time, things like spending time, mental effort, trying to get the substance, trying to use the substance, allocating time for that, having cravings, messing up your home life, your work life, your school life, messing up your social relationships and your personal relationships, giving up a lot of hobbies that you may have had, recreational activities that you may have done, sports that you may have done. All of these are part of what the DSM-5 considers as, you've tailored your life to seek out this substance because of addiction. So addiction is beyond just that physiologic, it's the social aspect. So having that support system, you've taken care of 9 out of the 11 diagnostic criteria of substance use disorder by having a good system, that's, for Muslims, that's faith-centered. And then the other 2, you sort of leave to the, the clinicians. You can, with medications and whatnot, you can sort of get people out of withdrawal. You can get people to detoxify and all of that. Some things are not reversible as well. That's the unfortunate aspect as well.
Okay,
right?
like what?
So I mean, with alcohol, it's got direct toxicity to the liver, as we know, right?
Sure.
So you get things like liver cirrhosis.
Mm-hmm.
The only cure for liver cirrhosis is to get a new liver at the end of the day, right? You can manage the symptoms and you can manage the sort of complications, but at the end of the day, it's irreversible scarring of the liver and their consequences. And I've seen people die from life-threatening bleeding as a result of that. Because when you get cirrhosis, you get scarring, nodularity in the liver, and that distorts the vascular architecture of the liver. So you get, you can have high blood pressure, like in your body. You can get that isolated to the liver, and that opens up vessels in the stomach, in the esophagus, and those can burst and perforate and bleed very briskly. And if they don't get treated in time, then you can die from from just large volume hemorrhage. And then even if they do get to it in time, there's not always a chance of getting that.
Wow. When does someone have when does drinking, I mean, obviously for us, abstinence, Muslims,
Yeah.
We don't drink at all, zero. But, from a clinical point of view, how much is too much when it comes to drinking, and at what point does that damage start occurring?
Yeah. So I think the important thing is we don't know, right?
Okay.
At the end of the day, our government has set out criteria for safe drinking, saying that for men, 14 standard drinks per week. So it's 2 per day.
That's okay.
Or for women, 10 per week. Yeah, that's considered okay. But at the end of the day, if you're hitting that maximum and you're doing it for 20 years, 30 years, I find I'm hard pressed to believe that your liver's safe. You know what I mean? And every person is different, right? Everybody will metabolize that alcohol differently. Everybody's liver is going to react to it differently. So I don't think there's a right answer to say that, okay, if you're drinking less than 10 drinks a week, you're okay. Because the other thing is binge drinking, right? Because binge drinking is life-threatening as well. Because you can get two things. You can get acute. So cirrhosis is one thing. That's like, repeated damage from alcohol over years and years and years. And then you get this irreversible scarring and nodularity of the liver that will affect your cognition, that'll affect your ability to, bleeding risk and sort of all sorts of other complications, fluid imbalances and all of that, ability to metabolize certain drugs. But then you can get direct acute alcoholic hepatitis, which is, you've hit your liver with a high amount of alcohol over a period of 2 or 3 days of binge drinking. And the next thing you know, you have diffuse inflammation and your liver just stops working, like at the snap of a finger, basically, right? And your liver is so important. It's what's called the liver, because you can't live without it. And that was the initial nomenclature, the naming of it, is that, all of a sudden your blood can't clot anymore. All of a sudden you can't regulate acid levels. So your blood becomes extremely acidotic, which in and of itself is life-threatening. And all of a sudden you're sort of, again, you can't metabolize drugs and all of that. You develop what's called encephalopathy, which is this acute confusional and agitated state. So again, I've seen a young person who was in his, I won't say early 50s. He had 4 small children and a wife, and he had alcoholic hepatitis, came to the ICU. Within, I would say, 36 hours, he passed away. We couldn't do anything. We couldn't manage his blood pressure despite high-dose vasopressing medications. We couldn't manage his clotting, and he was exsanguinating. He was bleeding from sort of multiple orifices. And you can't manage your blood pressure. There's nothing left really that you can do, unfortunately.
Wow.
Yeah. And we don't transplant. New livers unless there's proven sobriety in Canada. I don't know about here, but you have to have at least 6 months of proven sobriety. Yeah.
Well, that makes sense.
It makes sense, right? Because if you get a new liver, you're going to abuse, right? Yeah.
Yeah. I mean, I know of people here who've had transplants and haven't done anything differently. Yeah. Even while they're waiting for a transplant, they're still IV drug use and all these sorts of things, and
so that takes you off the list.
Yeah, that's fair.
Yeah.
There's people out there, kids and people who don't do that, who aren't going to destroy themselves straight away. But we said, like, the terminology, we talk about drugs and alcohol. They always say drugs and alcohol as though there's sort of like a difference between the two.
Right.
In my mind, as someone who deals with people, it's all the same.
110%. I didn't appreciate this until I started working in medicine. So I sort of in your second half of medical school, you do sort of clerkship rotations, and then you get into your residency and all of that. And then I'm seeing these people, and for every 10 patients that are coming in with substance-related problem, right? Whether it's alcohol or drugs, I would say 8 out of 10 are because of alcohol.
Wow.
Right? Liver problems, alcoholic hepatitis, alcoholic pancreatitis, bad decompensated cirrhosis, variceal bleeding. We talked about the dilated veins in the vessels. It's called varices, variceal bleeding. And these are not people in their 80s and 90s who've lived a full life, right? These are people in their 20s and 30s.
That young.
Right? And it's like, I'm getting goosebumps talking about this, right? Because it's always the hardest part for me in medicine is seeing young people dying and seeing young people critically ill. You sort of have a stomach for older people and doing that, and I'll be frank about that. But when you see young people and people who have wives and children and people who are reliant and dependent on them, and they're coming in and out of the hospital, they're sort of having these life-threatening complications. Some of them not making it out. Very sad.
And when it's self-inflicted too, it's just, man, this life is hard enough, right? I mean, isn't it really? Everything we're facing with our health, with everything, just the trials and tribulations of life in general, and losing people and relationships and work, and the test of life that Allah lays out in front of us. But we to see people choose this, to make things so much harder for themselves, to destroy themselves. And someone came on here and said something beautiful. It's not a beautiful thing, but he said it beautifully. Addiction's a family disease. It's, you see, you've got that one person in the bed, and everyone around them is suffering, and everyone that's around them is suffering. Their families, everyone's affected by one person's actions.
100%. It's your whole circle is affected by those decisions, and it's one of those things, right? You almost are a prisoner in your own mind, in a sense that your mind is so preoccupied with that substance, alcohol, drug, whatever it may be. You just can't escape it, and that's mental illness at the end of the day, right? And that's where we need, that's the root cause of all of this. I can talk about cirrhosis. I can talk about infective endocarditis, which I don't know if you've seen that at all. No, so that's most commonly in IV drug users. What you see is that every time you inject into your vein, you're introducing bacteria that maybe live on your skin and actually are healthy and fine. They're not causing any problems, but you're introducing those pathogens into your bloodstream, right? And then you're getting, and then a lot, depending on what the organism might be, they'll sort of camp out in your body. If they camp out in your spine, you can develop like a spinal abscess. And then, if you compress your spinal cord, you're not able to walk, you're paralyzed, you're incontinent. If you develop that in your heart valve, you get what's called infective endocarditis, which is this, you have 4 valves in your heart that kind of regulate the flow of blood to make sure things don't like leak backwards and all of that. So with IV drug users, you unfortunately get what's called tricuspid endocarditis, which is the valve that goes from the right side of your heart to your lungs. So if you're not getting adequate blood flow to your lungs, you're getting a lot of regurgitation and all of that, and then you develop bad right-sided heart failure, which your abdomen, your legs, and everything just swell up because you're not getting good forward flow. And then again, these are in the absence of drug use, you're seeing these things in patients that are 70, 80, 90 who've lived their full life, and then their heart's now starting to give out.
Okay.
You're seeing these people in their 20s and 30s walking around with like swollen legs full of water and edema, bad right-sided heart failure, and at the end of the day, they need at least 6 weeks of IV antibiotics, and they need probably a new valve. But you're not going to put a new valve in someone that's just going to go ahead and do it again, right? So then it's a vicious cycle. But it all comes back to this mental illness, right? And it's funny, I've had this discussion with some of my colleagues, and it's like, would you rather have bad, debilitating mental illness and addiction, or would you rather have a physical illness if you had to pick between the two? And I'd rather have a physical illness, because if you're in control of your faculties, if you're so preoccupied on whatever fixation it may be, you're not going to get out of it. Physical illness you can manage, right? And you can cope with. You'll have the mental strength to cope with. But if you're addicted, you're mentally vulnerable and you're mentally weak in that sense.
Yeah, it takes over every single aspect of your life, as you said. I mean, literally everything. You trade everything for it. Yeah. What's the youngest people you've said? Like, give us some stories. What's? Yeah,
I've probably in their mid 20s. I've seen people die in their mid 20s from fentanyl overdose.
Okay.
So I did this is at a different, like a more peripheral, kind of a little bit more remote hospital from the core of Toronto, but it's actually located right next to a reserve. And we had like a week where in the ICU, I think we saw 3 or 4 different patients, all in their 20s. They were all Indigenous, Aboriginals, and they showed up as a result of this, fentanyl toxicity. I don't know if it was a bad batch or what it was laced with or what it would have been cut with, but everyone got really sick from it. And I think of the 4, I think 2 of them survived, 2 of them didn't make it past, right? And you're having to tell parents that their child is not going to make it, right? Or you're having to tell spouses that, somebody, they're going to be looking after their kids alone, at least for the foreseeable future, right? So you're seeing these things, right? And yeah, these are people in their mid-20s. I've seen Probably the saddest case I saw was a couple, husband and wife, that had a small baby. Both were IV drug users and both developed infective endocarditis. One of them, as a consequence of bad heart failure and bad valvular dysfunction, went into a cardiac arrest and died on the ward. And then the woman, she ended up surviving. She ended up getting a new valve. But, probably between that and then months of recovery, rehabilitation, physical rehabilitation, before she even got to see her newborn.
Wow.
Yeah. And I haven't been able to follow up and to see how she's doing, but it was a rough go, and
Man, such a waste.
Sure. Yeah, it's very sad. Yeah.
Working in the prison systems here, I've met some really interesting people and heard some really sad stories. And I know of a woman who ended up doing a life sentence for murder. She's out now on parole for the rest of her life and making the most of what's left of her life. Yeah. But when she was 7 years old, she was dropped off the emergency room by her parents. They'd had overdosed her on heroin. Mm-hmm. They used to inject her with small amounts of heroin so that she'd go to sleep and not off and leave them alone so they could party and do their thing. So 7 years old, she gets dropped off there, that was her start to life, and so for it to end up where she did and doing the things she did, it's like...
It's a vicious cycle.
Man, it's going to happen. I know another guy who was at a similar age. His parents were methamphetamine cooks. They used to test out methamphetamines on him, injected into him when he was younger than 10, so he ended up with a habit, still has a habit to this day, new to Islam, trying to come into it, but has no idea how to walk away from the drugs addicted, because he's never lived without them.
So it's interesting you mentioned that, right? Because that, you're looking at kids whose your brain doesn't stop developing until probably your mid-20s, right? So, kids, teenagers that are using substances, that are going directly into centers in the brain that regulate pleasure, that regulate memory, that regulate decision making, and you're impairing those at a young age. That's going to impact cognitive function, in your adulthood, not let alone old age, right? So you imagine, these examples that you mentioned, for sure, right? Like you're looking at someone that's perpetually addicted to methamphetamines. You're looking at someone that had a rough go, obviously, with heroin exposure to start their life, and then going on to, unfortunately, lead to the life that she had, right? So these neuroplasticity, we talk about, like the brain development and sort of the full characterization of the brain doesn't come to fruition until probably your mid-20s. So people say cannabis and things like that. That goes directly into your brain, and that's going to affect neurodevelopment in adolescence. We're not talking about
Well, actually, that's what I wanted to talk to you about, this whole cannabis thing, because now it's medicinal cannabis, and people are getting prescribed it here now at a rate of knots. And I know, North America and stuff, I mean, we're sort of following them.
Yeah, we've legalized in Canada as well.
You have now.
In the last few years,
Don't get me wrong. Someone's got chronic pain, something that they really, it makes life unmanageable, and, sort of that's prescribed to them and it helps them with their pain and deal with their life. It's one thing. Yeah. But it's getting prescribed to people here for any old reason. Yeah. You turn up and say, I've got anxiety. And often they'll sort of tell you what you need to say. Or, it's big kickbacks, anxiety, I can't sleep, anything. So, and they're getting really strong gear. This stuff's crazy, There are 1,000 different strains, and now everyone's smoking. In our community, I mean, it's just becoming this thing. It's like we've almost convinced ourselves that it's different. It's okay. Yeah. The doctor gave it to me. The doctor can give us a hell of a lot of things that we aren't supposed to do.
Right, yeah.
You know what I mean? The doctor might suggest I have a glass of red wine once a week or once a day, and it's good for my heart, but that's not okay for me. I'm Muslim. Yeah. But kids are, they're just smoking themselves into oblivion. And you see, look,
you're talking about kids getting prescriptions for cannabis?
No, well, I haven't seen kids getting prescriptions, but we're talking about, if you're talking about people who are still in that developmental stage, late teens and stuff, early 20s, and it's not just that, it's just making it really available. Everyone's getting it, selling it to each other, but kids just don't think pot's a big deal. Look, my journey with all that stuff started when I was 13 years old with marijuana. I think with most people it kind of starts there, goes to other places. Yeah. But, and I couldn't see it at the time, but when I look back on it now and I'm surrounded by people that do it and trying to help them and stuff, it just still robs you of the motivation to do anything, really, to commit to life. You'll see constant patterns. I get families call, my son, he's doing really well. He was doing good in school. He's in university. He's working. Now slowly uni's taking a bit of a back seat. He's not working so much, and it just ends up he's dropped out of uni. He's hanging out with bums,
Yeah.
But for young people who might be watching this, like, this is something they should be taking seriously, right? It's not just, it's not doing nothing to you. It's affecting how you, who you are and how you're going to develop and interact with the rest of life, right?
Yeah. So it's interesting you mentioned that, right? And we see a lot of examples just even, in my own life growing up, seeing friends that were, ambitious, hardworking, and then, their whole life became about, smoking cannabis and seeking it out and all of that. And then, yeah, exactly. They lose their motivation. They become very apathetic towards life, and the goal just is getting high. So that's a huge part. I'm talking specifically about brain development, which, you look at one of the studies that they did on schizophrenia and the development of schizophrenia, which is a mental illness that's characterized by like psychosis, hallucinations, and sort of delusions and all of that. Sort of adolescent and teen cannabis use has an association with the development of schizophrenia and as an adult, because they, again, looking at the ability of your frontal cortex, which is your high level thinking and all of that, to develop normally, cannabis is going directly into that, and it's affecting the ability to fully develop that and round that out. So all of these sort of, small yet important and unignorable complications of cannabis, we sort of, it's been considered, it's harmless and not cigarettes. It's got neurodevelopmental abnormalities. It affects motivation. You have seen anecdotally, and many people around have seen people become quote unquote, call them potheads, whatever, right? So that just becomes their life, and they're just always so mellowed out and all of that. And you see that all the time. And it's kind of, I'm hard pressed to see a reasonable argument to say that it's harmless. And you mentioned prescription cannabis as being, in Canada, like, cannabis is legal, like recreational.
Also, I can grow,
walk
sell.
into a store and buy it. As long as, there's restrictions on where you use it, and if you do it at home or like in a designated facility, but you can just outright just get it just because you want it. Like, there's no prescription.
It's like Amsterdam sort of thing.
Basically, yeah, I guess we're becoming the new Amsterdam. Yeah.
Man, it's crazy. I mean, as a professional, as a health professional, I mean, that must really worry you.
Yeah, it irks me a little bit. I mean, at the end of the day, I'm not a policy maker. I'm a recipient of policy.
Yeah.
And we kind of roll with it, right? Alcohol is legal, and we see I can't do anything about that, right? At the end of the day, I can help the people that have suffered because of it, but that's kind of where my role as a professional stops. If they want to become sober, if they want to get better, if they want to improve their life, that's their decision, right? And I think social support and a system in place is where that starts. And I think for Muslims, as you mentioned, a faith-based system would be the way to go, because it's all connected to Allah subhanahu wa ta'ala at the end of the day, right? It's your dignity, your honor, your spirituality is from Allah. It's not from your friends or family. Like, at the end of the day, it's all from Allah. So I think that has to be the center if you're going to proceed with something like that. And I think that's it's obviously going to come with challenges to set up something like a rehab facility, but I think that the benefits would be amazing.
Yeah, I couldn't agree more. I mean, like, you got the 12-step program, and it's, strongly based around a belief in a higher power.
Right.
And, that works for a lot of people. But imagine us running these programs, with that understanding, but what we're educating, what it's based around is the correct understanding of that higher power. That's got to make a significant difference, because if my idea of a higher power is that the universe itself is my higher power, when it's simply creation, how far can that take me? You know what I'm saying?
And I think brotherhood is important too with that. So it's because this is a non-Muslim example, but I remember listening to a talk. This is a physician in Ottawa, which is the capital of Canada. He focused a lot on inner city health, and he actually had they had a house, and this is for people with alcohol use disorder, and like 5 or 6 people just lived together in that house, and they took care of each other, in the sense of looked after each other's needs, made sure they were all kind of good, made sure that nobody was kind of, straying off the path. And they kind of worked together to motivate each other. And I think that, our ukhuwa, our brotherhood, is much more powerful than anything that could accomplish. And I think that's why, by having that communal sense and a common goal, which is obviously going towards Allah subhanahu wa ta'ala, that I think would be super, beneficial.
Yeah, look, it's I've had people come on here and talk about, it's through brotherhood, and I guess sisterhood, for the
Yeah,
sisters
yeah.
who are dealing with this stuff is building that bridge back to community, because the person's behaviors and drug use and all those
Yeah.
sorts of things and addict behaviors have just burnt all the bridges, and a lot of them, they're just not comfortable to come into the mosque because they know that, a third of the people in there know exactly who they are and what their story is, and they've got that shame, and
Yeah.
we've got to be able to open up the doors to them and say, here's a way back, and past is past, and we're just happy to see you here. But the reality is that's not the attitude of
No, for sure.
many of us.
It's not, and a lot of the time when you're mentally ill, when you're in the lowest point and the most vulnerable point of your life where you need that help, you're also the most, I guess, standoffish is the best way to say it. You're the one who's pushing people away.
Yeah.
Right? If somebody comes and says, no, you need help, you're going to push that person away. So then, that, people who are trying to offer you help are definitely going to feel hurt and offended, and ego, whatever it may be, right? So education has to come on both ends, right? So the person getting better, but then the community and saying, these are people who are mentally ill, right? You have to look at it as mental illness, just the way you look at physical illness. You got to look at it as mental illness. They're not well when they said those things, or whatever it may be. They're not well when they were using drugs or dependent on alcohol, whatever it is, but they want to get better. So we have to look at it in I think that sense, is that this is illness, and we need to be a community that welcomes these people, especially if they're obviously sincere in taking that step forward. And that's going to take education on both ends.
Yeah, and look, as you say, it is a community thing, because the families just burn out. Like they become completely emotionally bankrupt.
Yeah.
They're my own mother went through it, where they've got to just completely switch their hearts off to you, not because they want to, it's not because they choose not to love you anymore, it's because they have to survive. They have to survive this, and the only way they can do that is to shut down and put up those barriers and walls and stuff. And for that person to then come and say, Mum, Dad, guess what, I want to get better, they can't just flick a switch on inside themselves, because it's just, they can't survive another round of that roller coaster of hope and disappointment and everything else. That's where other people have to step in who are fresh, with no emotional connection and love for the sake of Allah subhanahu wa ta'ala. All right, we're here, we'll take this. And being one of the people who does that, I burn out with people too, and I've got to hand over sometimes. Like, I might get a good couple of months with someone, but watching him up and down, I've got to hand off to a brother and go, listen, you got to take this for me, bro, because
you're taking a lot of emotional stress and grief that a mother or father would have taken. That definitely, it's only, you can only take so much as a human being. And you see that with these family members, and I don't talk to my sister anymore, I don't talk to my whoever. But one thing I do notice when I see Muslims in these situations, on life support, the mother is always there at the bedside crying. Like it's very, like, and I'm saying, getting goosebumps talking about this, but it's like, that mother's love is something so special. Like, no matter what that kid, that boy, that girl is doing, like, she's gonna be there, and the father too. And you see that, and it's like, it's crazy that the kid can mess up in such a huge way, but the love of the parent is still there, and it's sometimes it really shakes you when you see that they're reading Quran over their child, loved one, or whatever they may be doing, just making dua in the room. So there's, while having a conversation with them, they may kind of put up a guard. That in their core, at the end of the day, this is their child. There's something there that I can't explain, that I don't think, anyone can explain, but there's something there that connection will always be there. And even if, they're putting up a guard saying, no, I can't deal with this anymore, the connection's always there, I think.
Yeah.
Right. And I mean, it may be a little bit.
They're kind of stuck, like they've got no choice. It's hard. Actually, a Christian friend of mine a long time ago, he said that, I think he said the Bible says it, and I'm not too sure, and it's rare for me to come on one of these things. I wasn't quite anything from the Bible, but there is a saying in it that resonates strongly with what we're talking about, and they say that love is long-suffering. And definitely in the case of a parent-child thing, it's, man, how true is that? It is. It's like,
no, it's just
parents really, really suffer, and I never had kids of my own, and it's like, it's not something I've ever made dua for. It's not because I'm working in this. You see the best families. Like, I think parents tell themselves that, take the kids to madrasa, we'll do this, we'll do everything the right way. They've got everything mapped out, and just forgetting that human being is a human who is free to go left, right, and center, and more than likely will do that to some extent. And you've got to just hang in there and batten down the hatches and not sleep at night anymore, because, and probably the experience I had, giving, that I gave my own mum, it's like, I don't want that. Even if there's a 1% chance that I could be the dude that has to sit up at night wondering, if his daughter's hurting herself or safe, or my son, I wouldn't want that,
Yeah, no, you're obviously you're coming from a place where you've seen. Sometimes you see those kind of worst case scenarios, and it really it frames your way of
Bro, I see Hafiz of Quran who've become addicted to methamphetamines. You know what I mean? Where they've erased parts of their brain, they can no longer remember it. And like. But again, like behind that individual is a family who sat there one day, with joy and pride and gratitude in their heart, the day that they finished the last juz, and kind of thought that everything was going to be okay, and and then the other side of that, and it's just so hard because obviously prevention is our ultimate strategy is getting kids not to ever cross that line, but the problem is just. Kids are kids and youth are youth, and no matter how much you say and explain, I mean, you could show the most horrendous photos of everything that you're describing and the ins and outs and everything, but that kid still, most kids still sit there and look at that and think that's about someone else. It's got nothing to do with me. That'll never be me.
Right, because I'm just, I want to get that high, and that's it, right? Because you're only thinking of that, the now, right? The present. You're thinking in the moment.
Yeah.
We have, I guess, call it the benefit or the unfortunate reality that we see people at the end stage, right? Like I'm seeing the aging process accelerated again. Like I'm seeing 20-year-olds, 25-year-olds with heart valve problems, which, people don't get their heart valves replaced until they're 70, right? Or you're seeing people with end-stage liver disease, right? And people who don't drink and don't abuse alcohol, they get this in their 50s and 60s, if they get it, right? From other causes. So you're seeing these people in their 20s and 30s getting this, right? And if it's one of those things that if I could tell a young person that you're, well, yeah, sure, you're getting high, maybe it feels good, maybe it feels great, maybe that's all you want, but recognize that, for yourself, forget about what you're doing to the people around you, but for yourself, you are accelerating your aging. If you're going to end up with a heart problem, you're going to end up with, spinal cord abnormalities, and you're no longer continent. If you're getting up with constipation because you're taking so much fentanyl, these are old people problems, right? And these are healthy old people problems. Not, if you're going to want to drive a car, if you're going to want to, be able to pass a memory test to be able to drive a car, these types of things, like, and I'm talking in your 30s and 40s, this is probably not the path you want to go on, right?
Yeah, look, 100%.
But again, it's hard to say, it's like we've seen that. They see, their friend getting high and explaining, whatever hallucination they're having, whatever feeling that they're having, euphoria, and that's what they want, right? And that's the short-term thinking in younger kids.
Yeah, we think the consequence of whatever, I'll deal with things later. I turned 42 at the end of this year, inshallah, and I've realised that later is now for me. I rang your brother recently because my memory is really becoming an issue, and like I think that. I went through drug-induced psychosis, during my mid-20s. I survived that, and I came through it intact. Thank God for that. I don't have any lingering mental health issues, no diagnosed ones, ADHD, that type of thing. Right. But now, as my memory is it's becoming a problem. I mean, I just think, it's a bitter pill to swallow when you think, I did this to myself. But it's real. I mean, the brain, it's as you said, there's all these pathways and things and stuff going on, and I mean, the fact that I survived it all, the fact that I'm alive to sit here and have this conversation with you is alhamdulillah. I came through it good, and I did better than most and many that I know who never came out of it or who are forever in a state of psychosis. But it's still, it's like, late as now, it catches up to you.
Hamza, you did something that probably 1% of people do, I would imagine, right? Is to come out of all of that. Obviously, you found Allah subhanahu wa ta'ala, and, you've repurposed your life in a way that says, look, I know what you're talking about. I know what you're doing. I did it. I have to deal with the consequences. Like, you are like a content expert in an area where Muslims will we don't experience this, right? And you have that experience, you have that background, you have that knowledge of what things can do and how things are. And it's like, this is subhanAllah, this is like your purpose on this earth, I think, is to rescue these people.
Inshallah, brother.
And you're doing, mashallah, great work in this, I think.
Allah barik fiqh. Allah accept from all of us, man.
I
We
mean,
just, if we can save some others from going through the things.
No,
that,
exactly.
that
And
others went
how
through.
many, in your experience, how would you say, out of 100 people that are struggling with addiction and substance use disorder, how many people would you say have fully come out of it in a way that maybe you have?
Not many.
Not many, right? Yeah. So it's
Not many.
so challenging. Like, it's
Yeah.
you're trapped in your mind, right? That's what it is.
Yeah. It's,
So that it's a testament to Allah's help that you were able.
Allah's
to
mercy.
blessing, right? Allah's mercy.
yeah,
that you're able to get
100%.
out of it, right? And that mercy is for everyone, right? And we have to do our part here.
We do. I mean, look, I'll tell you right now, I didn't get, like, November this year will be 11 years clean for me, alhamdulillah.
Mashallah.
But I didn't get clean and I don't stay clean because of a decision I made. It didn't happen that way, It was literally Allah gave me something, gave me another chance, reached out and just gave me an opportunity to do things differently, out of mercy for me, out of mercy for my mum. Who knows? I mean, his reasons are infinite and beyond our understandings.
Yes.
But ultimately, it just came down to it's God that saved me. It's God that sustains me. There's nothing more to it than that. Obviously, we make our effort, right? Like, God feeds us, but God feeds the bird. He still has to fly out of his nest each morning and feed himself. I've got to think very carefully about who I hang around. I've got to think very carefully about the places I go, and finding healthy coping mechanisms for different things. But at the end of the day, as you said, it all comes down to Allah.
11 years is huge. That's,
Alhamdulillah.
Alhamdulillah.
Well, brother, listen, we've just ticked over,
Okay.
but Jazakallah khair. Thank you for
This is
coming in.
Absolute pleasure for me to talk to you.
Yeah,
I
likewise. Thank
appreciate
you.
it. Yeah.
And I know that people at home will find what you're saying very interesting and give us a greater depth of understanding about where all this stuff goes. It's not just drugs are bad. Like, there's more to it. There's science behind it.
And again, if I was to send a take-home message to any young person that was listening, is don't accelerate your aging process. It's that you don't want to deal with these things in your 20s and 30s. You have your life to live.
You've got your 70s, 80s, and 90s to deal with this
deal
stuff.
with constipation and things like that. You don't want to deal with it when you're 20, right? Exactly, yeah.
No, 100%. Brother, Jazakallah khair.
Yeah, cool.
Everyone at home, Assalamu alaikum wa rahmatullah. Allah barik feek. Good on you, brother.
Of course, Jazakallah khair, man.